Aloha gang, Dr. Russ Rosen here. Welcome to the OHC System Community Masterclass. That's what it is. And we are live. And let's see, I'm going to type right here. Let me know if you are here and if you have any questions. Okay, and then I'm going to go to another page since it doesn't show up there like it's supposed to. And next time I see Zuck, I'm going to talk to him about that. Let's see, no, wrong one. There we go. Okay, so if you're there, go ahead and click on that and we'll get going. So that's working. Yep, that's working. And this is working great. So today, gang, let me see if that shows up. Yep, there I am. Okay, Jan, I see you. I see you. Hi, good. All right, great. So, today we're going to talk about, let's see. Where did you go? I have so many windows open right here. Okay, today we're going to talk about how to handle difficult patients, questions, and situations. Have you ever had a situation where a patient asked you a question or they made a comment and you weren't exactly sure how to handle it? Have you ever noticed that in those situations, sometimes maybe you get upset or you get angry and it actually ruins the relationship? Well, surely that's happened to so many of us. Have you ever been working and you overheard your staff having a conversation and it literally was like nails on a chalkboard? It made you cringe. Well, that's what we're going to talk about right now. We're going to talk about how do we handle difficult patients, difficult questions, and difficult situations. So there's two things that we need to do. Number one, we need to understand L.A.A.S.R, L-A-A.S.R. So L.A.A.S.R stands for listen, acknowledge, ask, solution, and resolution. So whether you're at a bank and the bank teller has an issue going on with you, or it's with your kids or with a patient, it doesn't matter. This is a great way of handling difficult situations and really getting to the underlying issue. So we listen, we acknowledge, we ask appropriate clarifying questions to find a solution, and then we make sure that the solution actually has a resolution. So like with a patient, you should come in 3 times a week. That could be a solution, but it may not be a resolution because they may not want to come in that much, right? So there's a difference between solution and resolution. So we listen so that we know what they're saying, but also so that they feel heard. Really important piece of the puzzle. We acknowledge, again, so that they feel heard, and it de-escalates the situation. So they might have a charge. They might be frustrated about something. And if you don't acknowledge that, if you don't acknowledge what their concern is, they stay charged. And it's hard to find resolution when at least one of us is charged. So we're going to use acknowledging to de-escalate the situation. We're going to ask clarifying questions. Clarifying questions help us find out the truth. And that's what we need to know. So I have an old axiom, which is when you clarify the truth, the solution becomes self-evident. It's not when you bitch and whine and moan. It's when you clarify the problem, the truth of the problem, clarify the problem, the solution becomes self-evident. Then we find a solution, and then we want to make sure that it's a resolution, that both sides of the equation feel good about the solution. That's a resolution. Okay, so here's the formula that we need to use. The first thing I need to do is what I call a temperature reading. So I want you to imagine a patient just said to you, my doctor says that I should stop seeing you, that I should go see a real doctor. For many of us, that would piss us off. right? Now, my experience is when I'm pissed off, it decreases the chances of me having a good conversation that leads to a resolution. So, step one is do a temperature reading and see if you're pissed off. If you are, now's not the time to have this conversation. Okay? Step two, we need to look at the classic blunders. What I like to do is break it down into two different behavioral styles. One is what we call the assertives, and then we have the non-assertives. If you know the disc language, super high D's, drivers, give me the ball, I'll score the touchdown, and get out of my way. Those can be assertive. And what I happen to be one, and we can get angry and we can render ourselves offensive. We don't think we're offensive. We think we're just telling it like it is. But the rest of the world thinks we're offensive. Okay, then there are the non assertives. The non assertives really don't want any confrontation. They don't do well with confrontation and they join what I call the okay corral. They just say okay to everything. My doctor said I should go see a real doctor. Oh, okay. And then you go home and you don't sleep at night because you're so pissed off that you didn't say something about it, right? But these are the two different kinds of blunders that we can make. And you probably, as I'm saying this, recognize which one you can err towards more often. Of course, we can both do both. I mean, we can do both, but most of us will err on one side or the other. The third step is the implied message. What is the implied message? Hey, listen, could you just adjust my low back today? Well, what's the implied message? Well, that implied message could be, you hurt my neck last time, so would you please just adjust my low back? That's what it could mean. It could also mean, my low back is really sore today, could you adjust my low back? Right? So the thing I want you to understand is that you can't know what the implied message is until you do one thing. What is that one thing that you must do? Ask. You need to ask. So, excuse me, one of my favorite responses is, hey, that's a great question. Why do you ask? Or, sure, why do you ask? But clarify what they're meaning. Have you ever found yourself where someone asks a question or makes a statement and you go on a 5-minute discussion or lecture about something and at the end of it they go, yeah, what I meant was, right? So let's not find ourselves in that situation. Just clarify. What is it that they're actually asking? Okay. And then the next piece is, what is your truth? What is it that you actually want to say to this person? Sure, I'm happy to just adjust your low back today. Or no, I can't just adjust your low back today. I'm going to have to do an assessment, blah, blah, blah. Like, you've got to be clear about what it is that you want to say. Let me take a look at this note here. Um, let's assume that you did hurt him last time. You know, if you did hurt him last time, then you need to use L.A.A.S.R, listen, acknowledge, ask, solution, resolution, to help hear them, de-escalate that situation, ask clarifying questions, right? So did it hurt right when I did it, or did it hurt later on in the day? Those are two very different things, right? And again, these are very specific things we need to do so we can find a solution, so we can find resolution. So after we've done that, sorry about that. After we've done that, we're going to use L.A.A.S.R, listen, acknowledge, ask, solution, resolution. So our formula is, we're going to get a temperature reading. We're going to look at what our possible classic blunder will be and don't do it. We're going to ask ourselves, what could the implied message be? And then we're not going to mind read. We're going to actually ask to find out. And then we're going to think about, what is the truth that I would want to say? Here are some classic issues and blunders. You know, Doc, that's too expensive. Well, a classic blunder for an assertive would be you can't afford not to get care. If you don't get this taken care of, blah, blah, blah. And how much, it's only $4,000 program, better than 3 nights in a hospital, right? That's what we could do as an assertive. The non-assertive, oh, okay, sorry. Well, I could decrease the price, and I could come to your house and do your windows and clean your toilets if you'd like. Right? Like neither of those are good. Let's not do those. Um, Classic blunder. Patient says, I'd really like to do this. I just don't have time. I don't have the time to do it. Again, the classic assertive. What are you talking about? You don't have time. You've got this going on. You don't get this taken care of. This is going to happen. How can you say you don't have time? Blah, blah, blah. Non-assertive? Okay, well, we could just have you come in once a week. Right? It doesn't work. Neither of these works. We need to clarify the truth, right? Clarify the problem, find a solution to the problem, etc. I don't think this is working. Assertives, what are you talking about? It's not working. This isn't feeling better yet. I told you it wasn't going to feel better yet. I told you that first we would see this, and then we would say that, and then we would say this, right? All that does is ruin relationships. Non-assertive, I'm so sorry it's not feeling better. Right? Where the truth is we need to find out it's not feeling better at all yet. Or, yeah, my elbow's not feeling better, but my 35 years of daily headaches is gone, right? Or, well, we had discussed it would probably be a month before we expected any kinds of symptomatic changes, and we're on the second visit, right? So again, all of these are so critical that we use this formula. Classic ones. I think that I'm at a +8 as far as my overall health and well-being goes, but I have terrible symptoms, and the chart is very clear. -10 is near death, right? 0 is I'm comfortable, I feel good, but I'm not functioning at my optimum, and +10 is I'm at optimal health. So somebody has chronic, miserable pain and symptoms and problems, and they say that they think they're a +6. But if they have any symptoms at all, they're below 0. Again, these are the kinds of things that can come up. Where do you want to get to? Oh, I think I want to get to a +1. Well, why don't you want to get to a +10? What's wrong with you? That's an assertive, right? Or, great, you can get to a +2. It's going to get worse. It's going to progressively worsen. It's going to cause you damage. Probably get past the point where I can help you at all. But if that's what you want, great, we can do it. Again, this just ruins relationships. So there's all kinds of questions. There's all kinds of comments. You hurt me last time, doc. I don't think I need to come in so much. Could these adjustments be causing me to get lightheaded or dizzy? If you hear yourself say yes or no, you blew it. Yeah, I think they probably could. Boy, I was talking to my uncle who's a neurosurgeon, and he said that would be the first symptom that you're causing a stroke. Are you glad you said yes? No, it probably can't. Too bad, because when I get adjusted, I feel this life force come through me, and I feel connected to the Akashic records of the past, present, and future, and I feel this amazing awareness come through me. Are you glad you said no? Clarify. Clarify the problem, the solution becomes self-evident. So here's the deal. If you have any questions, go ahead and type them in. I'm going to get back to that page right now. On Thursday, I'll be jumping into the club. And if you would like to, and if you would like to dive into this, an entire hour on this subject, we have a document of the 32 most common statements and questions and situations, and exactly how to handle them in this format. So we look at the temperature reading, we look at listen, acknowledge, ask, solution, resolution, and this is something really for you and your entire team. If you've had if you've been working and heard your team say things that made you cringe, they need to know how to do this. And of course, they're welcome into the club. So let me look below. We've got, I guess I have to hit this little gizmo right here and I'll recheck. So we've got, let me see. No, 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 no. Let me see. Is that the shirt I got on? That's the shirt I got on. Okay, so no questions. If you'd like to jump in to the club this Thursday or watch the replay of that, just put club below and I'll get you a month free in there. I will be giving out that 32, the 32 most common difficult questions, statements, situations kind of thing. And I'm positive if you go through that module with your team and those 32 questions, it'll save you a whole lot of misery down the road. So if you're watching this later and you have any questions, go ahead and comment below and I'll answer those for you. Again, if you want to jump into the club, just go ahead and put club below and I'll send that to you. If you know other people that you think would find value in these kinds of little master classes that we're doing, let me know. Hope that helps. As always, much love and aloha. Bye, gang.